Today I want to go over briefly dehydration. Dehydration, causes, signs, best way to test for it, and best treatment options in terms of dehydration. I don't personally wish dehydration on anyone. I don't know if you've ever experienced it, but it is not pleasant. Last year, prior to Thanksgiving, I got violently ill and was unable to keep any fluids down of any kind. My body stopped taking in fluids. They went in, they immediately came back out. And eventually, because of the lack of intake of fluid, my kidneys shut down. I ended up in the hospital. It was very painful, not a pleasant experience. So dehydration is a bad thing. You don't want to experience it. But what we talk about dehydration, the main cause is, of course, lack of water intake or excessive loss of water or high solute load. In my case, I had both of those, lack of fluid intake and an excessive loss of fluid because I was sick. And this can be especially dangerous in children. If they become violently ill and they have vomiting or diarrhea, you can lose a great deal of fluid in a very short amount of time. So anyway, dehydration, lack of water intake, excessive loss of water, it comes about due to sickness. It can come about because someone doesn't drink enough water and then they sweat a great deal, or because of their diet and other things, they have a high level of solute in their blood, a high level of things dissolved in it, various types, and this can cause dehydration as the fluids get all out of balance. Signs that someone has dehydration include fever, sweating, hyperventilation, rapid weight loss, decreased urine output, and in my case last year, zero output. The kidneys just shut down. Poor skin turgor. Skin turgor basically is if you pull up the skin on the back of your hand or behind the arm, you pull it up, tent it up and let go. If you have good turgor, it goes back to its original place rapidly. If it goes back to its original position slowly, this is poor skin turgor. So dehydration, poor skin turgor tends to be a sign of that. And then increase in the solutes. Things like serum uric acid lab values go up and those sorts of things. Anyway, the best lab assessment for dehydration is to test for serum sodium. Now, normal level is 136 to 145. If it's outside of that, then you have a strong case for dehydration. The best treatment for dehydration, the best way to rehydrate the body is to take water orally by mouth or to put a 5% dextrose solution in the water. In my case, my body was unable to process it, and so it had to go in intravenously. But the best way to treat dehydration is drink lots of water. So this has just been a basic overview of dehydration, its causes, its signs, best lab assessment, best treatment. And if you'd like to learn more about this and related matters, underneath this video, you'll find a link. If you'll click on that link, it'll take you to the website that has that information. And while you're on that website, you should also find a link to an ebook that's ready for immediate download. Today we're going to talk about fat. Now everyone assumes that fat is automatically a bad thing, but actually fat is a necessary part of our health. It's excessive fat that's the problem. And so we're going to just go over some of the basic good and bad of fats and then refer you to another website where you can get more information. But we're going to begin by just looking at some of the good things, the beneficial things related to fat. First, fat helps provide insulation for the body. If you've ever noticed, people who have excessive body fat in warm climates need to keep the air conditioning set very low, whereas those who have very little body fat tend to get very cold easily, even in rooms that are of moderate temperature. So the amount of body fat you have actually acts as insulation, which can be good or bad depending on the climate and how much body fat you have. So the fat in your body actually acts partially as an insulator to keep in body heat. Next, fats are good because they help the transportation of fat-soluble vitamins into your system. So some vitamins are water-soluble, other vitamins are fat-soluble. The fat-soluble vitamins need the fats in order to transport them into your system, and therefore you get the good out of them. Now the downside of fat-soluble vitamins is that if you take too many of these, you get an overdose of them, it's stored in the fat and can become toxic. So you need to be careful about the quantity of fat-soluble vitamins you take, but the fat is necessary for the transportation of those vitamins into your system. Next, fat helps provide a source of energy to your body. If carbohydrates are not available, which rapidly get turned into sugars and other things for body energy, then your body can grab a hold of the fats, which is basically stored energy, and keep you going. So your body will actually want to store fats against future needs, so that as you try to lose weight, sometimes your body works against you. It starts to worry, hey, wait a minute, we don't have enough storage here. If you lose more fat, the body gets worried that there won't be energy in case it's needed in the future, and sometimes works against you in weight loss. But basically, fats are stored future energy, and so fat is an energy source for the body. Also, fats are essential in the creation of linoleic acid, which is an essential acid in the body. Fats help in the production of that particular necessary acid. So those are some of the goods when we think about fat. Some of the bads, though, are related to our health of excessive fat. If you eat excessive fats and therefore develop excessive fat on your body, it leads to weight gain, which can lead to stroke and heart disease, which of course are deadly. None of that's good. And so what you need to do is keep your intake of fats less than 30% of your daily caloric intake. Less than 30% of your daily caloric intake should be from fats of all kinds. So when you add up the various saturated and unsaturated fats and that sort of thing, you want to keep it less than 30% of your daily intake of calories. Now, most people say that the bad fat is cholesterol, but cholesterol is not all bad. It comes in two types: high-density lipoprotein and low-density lipoprotein, with the shorter acronyms of HDL and LDL. Your cholesterol is considered high if it's above 240 milligrams per deciliter. It's a measurement of density there. And also your HDL and LDL need to be in the correct ratio to one another. If one is high and the other is excessively low, then you have a out of proportion cholesterol reading there. They're too far apart. They're not in a good ratio to one another. This can also be bad for your health. So these are some of the bads when we think of fats: too much fat, out of proportion cholesterol, things like that. But fats themselves are a necessary part of our health and living, and if they're used in moderation, kept less than 30% of your daily intake, they're not bad. They're actually good. They provide a lot of beneficial benefits to the body. This has been just a basic overview then, talking briefly about some of the facts related to fats. If you'd like to learn more about this or related matters, underneath this video, you'll find a link. If you'll click on that link, it'll take you to that website that has that information. And while you're on that website, you'll also find a link to an ebook that's ready for immediate download. In this video today, we'd like to go over the guidelines that the U.S. Department of Health and Human Services have provided to assist people to help them stop smoking. So the following guidelines to help smokers quit have been established by the U.S. Department of Health and Human Services. The first guideline is anytime a smoker, or anytime actually any patient comes into a doctor's office, the guideline says, ask each one, do you smoke? And if so, record the status and ask them every time they come in. So next visit, are you still a smoker? And record the status, yes or no. So you're asking about it each time they come in and you're recording it. The second guideline is, if they say yes that they're a smoker, then part of the visit ought to be spent at least talking with the person about why they should stop smoking and give them the health reasons for it. Not only the detrimental effects on their health, but the positive effects, the benefits to their health if they don't smoke. So both the pros and the cons, the pluses and the minuses, the benefits and all that, to advise them so that they would stop smoking. Then, after you've recorded it and given them the information, talked to them about that, you need to ask specifically, are you willing to quit? If they say no, then provide support and continue giving them information. Hey, read this, think about it, we'll talk about it next time. However, if they say, I am willing, you've convinced me, I've noticed the damage to my health, I want to stop, I want the help to stop smoking. If that's the case, then you need to provide resources for them. You need to get them the help that they need in order that they might truly quit. Among those resources then are, first, set a plan. You know, the old adage, it's silly, but it makes sense. If you fail to plan, then you plan to fail. So if they've said, yes, I'm willing, and say, good, we're going to talk to you about a plan and put that in effect and get you the helps to see that plan through so that you'll be more successful in quitting. Some people have the internal gumption, the strength of will that they just quit cold turkey and that's it. Most people are going to need help. So part of assisting them with that help is setting up a plan. And the first step in the plan is to set a date when they are going to begin to stop smoking. Here's the date. And you try to make that date within 2 weeks of the time of that appointment. Don't let it go any further out than that, because if you do, chances are that they won't remember it, they won't keep it. So within 2 weeks of the date that you're talking to them, say that's the date that you agree you're going to stop smoking. So first thing you do is you set a date. Second, on that date, make sure all cigarettes are removed, that there are no cigarettes within their ability to get to. Having them around is too much of a temptation. Talk to them about some of the places where they like to smoke, where they're going to be more tempted to smoke after a meal, when they drink, things like this. Make that connection for them so that they realize, hey, it's going to be worse for you, not during the day, but maybe at times of boredom or times that you're used to smoking, after a meal or while drinking. So remove the cigarettes, set a date, remove cigarettes, talk to them about some of the challenges that they're going to have, and then enlist the help of family and friends. It's critical that you get a support group around the person who will cheer them on, who will help keep them strong when they want to be weak. If they really want to quit, having the help of friends and family who will assist them in that is critical. So you've made a plan, set a date, removed the cigarettes, enlisted the help of family and friends. You've anticipated the challenges by talking to them about what they can expect, times when they're going to be most tempted to want to go back to smoke. And then finally, to help them out, you might suggest some prescription medications, things like the patch, gum, lozenges, things that have nicotine in them, in order to assist them with the nicotine cravings. I mean, they're addicted to a substance, you're trying to wean them off of that substance. Sometimes a step-down program where that substance is gradually removed from their system can be beneficial. All right, so these are the guidelines from the U.S. Department of Health and Human Services to help smokers quit. When they come in, you ask them whether or not they smoke, you record the status, you advise them that they ought to quit, and you provide the health reasons. If they are willing to quit, you provide resources. You give them a plan, set a date, remove the cigarettes, enlist the help of family and friends, let them know of the anticipated challenges, and then perhaps recommend the patch, gum, lozenges, or prescription to help them with nicotine withdrawal. This has just been a basic overview of these guidelines. If you'd like to learn more about this or related matters, underneath this video you'll find a link. If you'll click on that link, it'll take you to the website that has that information. And while you're on that website, you'll also find a link to an ebook that's ready for immediate download. Today we're going to take a little bit of time to talk about several methods or ways that you can help people reduce the amount of fat eaten in their diet, how to reduce the amount of fat that is consumed in a person's diet. I've got 7 ways on the board here behind me. Obviously this does not exhaust the topic, but just to give us a basic overview and to talk about things that you can do not only for yourself but to help others reduce the amount of fat eaten in their diet. So the first one, we talk about the importance of nutritional labels, the importance of nutritional labels. The government requires nutritional labels on food to talk about the amount of fat in that particular product. And so in educating someone on how to reduce the amount of fat in their diet, you need to teach them how to read a nutritional label and say, always look at the back before you buy the product. And if you're going to consume it, obviously you can't do this for restaurants, although actually some restaurants do print fat content for various things that you order off the menu, especially fast food places. But essentially, when they're buying their own food and looking at these things, you tell them to look at the nutritional label, see the amount of fat per serving, do the simple calculations to figure out how much would be consumed in your average serving, and realize that the goal then is that less of their daily caloric intake, less than 30% of it should be from fat. So less than 30% of the daily calories consumed need to be from fat. So you're trying to get their calorie fat consumption less than 30%. So nutritional labels are key to that. Number 2, encourage them to eat more fish and chicken and less red meat. So if they can make a swap, if you will. Okay, you might want a hamburger here, instead have the chicken sandwich. You want a steak, why not have the fish? So encourage them to make these swaps and eat more fish and chicken and less red meat. Third, encourage them to eat more vegetables and less meat. So we've already made the meat swap, and then from there, increase vegetables, decrease the amount of meat eaten per day, per meal. Perhaps if you can get a salad in without chicken on it, and not too much dressing, you reduce the amount of fat, and the calories coming in are more healthy. So That helps with eating more vegetables, less meat. Number 4, encourage them to eat smaller portions. Sometimes someone wants to eat something that they really like. It's got high fat content. Tell them that's okay. Just eat less. You don't have to fill up on this or eat a huge amount. Choose smaller portions, and if they were to do this not just on the time that they feel like they're cheating, eating something that's higher in fat, but for all they're eating, to lessen the portions that they're eating. Eat less portions per meal, reduces the amount of calories coming in overall, and certainly reduces the amount of calories coming in from fat. So eat smaller portions. And then 5, when they're given the choice between saturated fats, trans fats, and unsaturated fats, to always choose the unsaturated fats. So once again, the nutrition labels are key here, but eat unsaturated fats and try to avoid saturated fats and trans fats. Between saturated and trans fats are obviously the worst. So stay away from the trans fats altogether if you're able to. Saturated fats, keep them to a minimum, and prioritize, if you are going to have fats, unsaturated fats. And then 6, in food preparation, encourage them to not fry the food. Or for yourself, I want to lower my amount of fat consumed. So when I'm going to prepare my food, or I'm going to have my food prepared by another, or I'm telling someone else about food preparation, don't fry the food. You're frying it in fat, which of course adds to the fat content of the food. Find other ways that are just as tasty to prepare the food without frying it. And then finally, number 7, eat less snack foods. Now, we're not saying snack less, we're eating less snack type foods. Snack type foods are going to be like potato chips and cookies and things like that, that obviously are going to be high in the fat content. If you need a snack, eat an apple, have some carrots, things like this. So snacking is okay, but when you're snacking, more vegetables, less snack type foods that are high in fat, usually saturated and trans fats. These are just some of the ways that you, in educating someone else or for yourself, can encourage less fat intake in the diet and thereby improve health. There are obviously more things that can be said under this way, but there are 7 ways to reduce fat in a person's diet. Nutrition labels, key. Information, you need that information. Nutrition labels, eat more fish, less red meat, more chicken, less red meat, eat more vegetables, less meat, smaller portions, unsaturated fats, don't fry your food, and try to minimize and or get rid of the snack foods. If you'd like to learn more about this or related matters, underneath this video you'll see a link. If you'll click on that link, it'll take you to that website, and while you're at that website, you'll find a link to an ebook that's ready for immediate download. Today we're just going to go over just a few of the basic facts related to skill fitness, how you can tell what level someone has in a particular skill, how fit they are, and it can be broken down into 6 categories, and I just want to briefly go over those categories so that as you're thinking about skill fitness, you'll know what to be looking for. So first, when we think about someone's skill fitness level, we need to think about agility. Agility is the ability to change body position rapidly and to maintain control over your body movements. Someone who has high agility can rapidly change body position and has a high degree of control over their body's motion or movements. When we think of agility, we tend to think of people like gymnasts, these sorts of things. They have a high degree of control over their body movements as well as the ability to change their body position rapidly. Along with agility, we have balance, and this is the ability to stay upright while moving or standing. And once again, we might think of a gymnast on a balance beam here. Their ability to remain balanced, to stay upright while moving or standing. After balance, we have coordination, and coordination has to do with the relatedness or connectedness between what the sense information coming in from the eyes or the ears or other senses as it relates to the body's movement. And we talk about good hand-eye coordination, good foot-eye coordination. So a soccer player would obviously need good foot-eye coordination. As the ball is coming in, they have to coordinate body movement to meet the ball with the feet and send it where they want it to go. Same with perhaps a baseball player with good hand-eye coordination, looking to hit a pitch as it comes in. The eye is receiving the information and they're able to coordinate body movement related to that sensory information that's coming in. Next, power. Someone's skill fitness is related to their strength plus their speed. Strength plus speed is the way we come up with power. Someone can be fast and not very powerful. They can also be strong and not necessarily powerful. But strength plus speed equals power. When we think about this, you might think about what's necessary in terms of a baseball player hitting a home run. They need to be strong and fast in order to connect with the pitch that's coming in and send it over the fence. Next, we think reaction time. Reaction time is the length of time between when a signal is given, whatever that is, visual or audible, and how long it takes them to respond to that stimulus, that external mechanism that says, hey, start. So the reaction time then is the start time after the signal's received. Here you can think maybe of a sprinter down waiting for the sound of the signal gun to go off, and then to immediately after that sound leap from the line and sprint down the lane. So start time is the amount of time it takes from when they hear the signal to the body's beginning motion. And then finally, speed. Remember, we said power is strength plus speed. Speed is the ability to perform a motion or to cover a distance in a very short period of time, short span of time. The motion speed, we might think here of a boxer's ability to throw a quick punch or jab, and then covering distance in a short time span would once again be the sprinter or the football player getting his time on his 40 and that sort of thing. So speed is the ability to perform a motion or to cover distance in a short time span. Well, anyway, these are the 6 skill fitness categories: agility, balance, coordination, power, reaction time, and speed. And where you fall in all these categories would be the level of your skill fitness. And of course, as you evaluate this, you can find areas perhaps where there's areas to improve, weaknesses, and then you can focus on that particular category of skill fitness and try to improve their hand-eye coordination, their balance, their agility, their speed, things like this, as you put together a training regimen for someone else or for yourself. This has been just a brief overview then of skill fitness and the 6 areas related to it. If you'd like to learn more about this or related matters, underneath this video you'll find a link. If you'll click on it, it'll take you to the website with that information. And while you're there, you'll find a link on that website to an ebook that's ready for immediate download. Anytime someone comes to you desiring perhaps to learn about how to train better, they have health objectives, they want to be more fit or healthy, if you're in the position of providing an assessment and putting together a training program for someone, or you just want to know more about it, I'm going to go over some of the objectives that are critical for that process. So first of all, what you need to do is establish a baseline. Where is someone right now before you start talking about where do you want to go and how are we going to get you there? So the first thing you do in a fitness assessment is, before establishing the objectives, when you do the assessment, you need to look at the following 5 things. And the first thing you need to look at is their heart and lung efficiency, their cardiorespiratory efficiency. You need to know that, once again, to find out where they are right now. Establish that baseline before you move on. Second, you need to know about their dynamic movement or their posture. Where are they there? Where do they want to be? 3, you need to go over their physiology, get their heart rate, their blood pressure, resting, and then perhaps with moderate exertion, just to get an idea of the range there as well. You want to make sure you assess them for their fat and muscle composition, get their body mass index, their waist to hip ratios, things like this. So once again, establishing where they are now as to their fat and muscle, how much fat, percentage body fat, how much muscle composition, get them on the BMI and things like that. And then finally, their athletic ability. And here you might just want to check a baseline. What are they able to do with bench press, squat assessment, this sort of thing. Once again, all of this just to establish this is their level of health right now. This is their level of fitness right now. This is where they are as a baseline. This is what they're capable of. You don't want to take someone without doing any sort of assessment and say, let's go run 5 miles, if they're not capable of achieving that because of these issues here. So you begin a fitness assessment with their cardiorespiratory efficiency, their posture, heart rate, blood pressure, BMI, waist to hip ratio, bench press and squat, and you collate all that together to get a snapshot or a picture of what someone's capable of. From there, you can then establish a fitness program. It allows you to compare as you move along. Okay, this is where they were, this is where we are now as you're going along, to assess progress. and also to see how effective the program was. So for effectiveness and for measuring progress for a particular regimen, you've got to have this beginning information. So before you get started recommending anything, get the baseline and then work from there. If you'd like to know more about this and things related to it, beneath this video there's a link. Click on it. It'll take you to a website with that information. Also on that website you'll find a link to an ebook that's ready for immediate download.